I'd like to introduce my guest today, Dr. Elizabeth Livengood. Thank you for joining us today.
My pleasure, Linda, as always. Thank you.
So today, explain about your practice as an LDN prescriber.
All right. Well, I learned about LDN during my residency, so I was very fortunate that way. And of course, started out with the first LDN book. That was my guide. And, after attending the conferences since then, my practice with LDN has developed a lot. So I think initially we thought, okay, 4.5 milligram, we've got gobs of research on that. Let's hit 4.5 milligram for every patient. And of course, we know now that's not a requirement. The beauty of working with this is that it's very individualized. So then I started prescribing at 3 and thinking, okay, well, if it's not ideal, we can go up or down. Well, that didn't last long because which way do you go, right? So here's where we're at, or where I'm at this point, is to start around 1 milligram. And for patients who are very sensitive or have a high antibody count or more complex situation, I might even start at 0.5 milligrams and then work up in very small increments of either 0.5 or 1 milligram. So it's a lot easier to find the ideal individualized dose for each patient. And it just depends on so many factors, such as the things I just mentioned, complexity, sensitivity, but also, their digestion capacity. How well do they absorb? What are their sleep patterns? What are their lifestyle patterns? So it's pretty cool. And I think that's modern medicine, ideally, is to be individualized. And that's a way we can individualize LDN. And then in terms of what I use it for, I primarily treat autoimmune conditions and some pain conditions, which have a lot of overlap there.
When you said starting low and titrating up slowly, if you had a patient that was ultra sensitive and you started them on 0.5, how soon would you expect to increase that?
So I almost always know within about a week what's happening with that patient, but when I'm titrating slowly, I try to wait 2 weeks. And I know that's actually a lot slower than some practitioners, but the problem is if a person has some little hiccups like, oh, I'm not sleeping well, or I had vivid dreams, I need that 2 weeks to see if the side effects are just going to go away or if we need to change the dose again. So for example, one recent patient, I started at 1 milligram. She had cut it in half, so she was at 0.5. She still had some, I think, digestive symptoms, some little side effect thing. She'd given it a couple weeks. And so I actually re-prescribed her starting dose at 0.25. I don't often have to do that, but that's what you look for. So that really close communication in the first week or two is important. So it took us 2 weeks just to find a good starting dose for her.
How's she doing now?
She is, here's one of my favorite traits in a patient. She is being very committed and tenacious. She's doing okay, but she was just willing to work through that. And that's what it takes. A patient who just wants one pill and walk away from the prescriber is probably not going to work for them. She was really, workable and trusting and committed to giving it a good college try, So let's, speaking of qualities that I need in patients to get the best results, one is that commitment to trying the LDN and working through the process. So this could be a commitment of, I tell them minimum 3 months. That's just to let us know if we're on the right track, if we're going to see some results. And then to actually clear a disease state or get back to some kind of normalcy, that's well beyond 3 months. 3 months is let's see if this is going to help. And then, depending on the condition, I'm asking for a commitment of at least 6, but usually 12, 18 months to get to some resolution. And beyond that, the next question is, well, am I going to be on this the rest of my life? Well, I don't know, maybe. if it's helping, the question is, how do you want to feel good for the rest of your life, right? So those are the questions a patient needs to ask when they're starting a medicine is, am I committed to this? Am I willing to work with my provider or prescriber? And, do they have a hang up with being on a medication? And I'm a naturopath, so a lot of my patients do. Like, being prescribed a pharmaceutical is a last resort for a lot of my patients. And I do explain to them this is synthetic, it's a medication, but it's extremely low dose with a very safe profile and a very wide therapeutic profile. So it helps a lot of things with very few side effects. You can't ask much more out of a synthetic medication, So besides a patient needing some commitment to the program, the other issue I see actually is that patients want to start it. They're like, great, I got my LDN. They get their starting dose. We taper up to an individualized dose, and then they disappear for 6 months. And we call this lost to treatment, lost to care in medicine. And maybe they're still on it. Maybe they went to a different prescriber and said, hey, here's my dose, keep me filled up. But they've lost that relationship of actually treating them as a person and not just treating them as a prescription number. So that's one other characteristic that I would like to see in my patients is the relationship. So we have a commitment to the plan, but then we develop a relationship where for me as a naturopath, I like to try to treat the whole person, and that requires time and commitment and checkups and follow-ups. To that end, I started a membership program this year. I'll tell you, Linda, I was inspired to start this program at last year's conference, February of 2020. And I wrote down all the details while I was on that trip, and I just implemented it this year because, of course, COVID happened the month after we got back, at least in the States. That's when we got our lockdowns. So I've just implemented it this year, and it's actually ideal for a person who is starting LDN or having complex issues or having an experience with an autoimmune condition, because this is the person who needs regular follow-up. And if you can contain your costs and you know that each month it's only going to be a certain price for your doctor's visits, your prescriptions, all the services that you need to have care for your health, isn't that worth it? And of course, I've made my memberships where, it's accessible and affordable. It's, unfortunate, or, we pay for our healthcare here. So that's how that goes. But we have to make it accessible. So that commitment to an ongoing relationship is super important. So I've tried to make that as easy as possible.
Do they do an annual membership, or is it a lifetime membership? How does it work?
So I initially ask for a 1-year commitment, and it's monthly. They get their monthly follow-ups. They get their blood draws whenever they need them. Treatments, which can include a variety of things: acupuncture, medical massage, nutritional IVs, hydrotherapy. There's a lot of different kind of treatments depending on the condition. But after the year, then they may choose to continue the membership, or maybe they just go to, quarterly or however, like kind of pay as you go, I suppose, just as needed treatments. But that first year, especially if, they've come to me, meaning they've tried all their other insurance-based providers, that's usually what that means. And then they come to me, and that means we're working on something really difficult. So I think a year commitment is not asking a lot, considering it's probably been in the works for years to get to a place of dis-ease,
Well, when you have a complex patient, and I know you said it can take 18 months, on LDN, in your opinion, across the board, if you were pushed to say, hands on heart, where would you feel a patient would start to notice something, however small, that LDN was doing something? What would you say, time frame wise?
Honestly, the way you phrase that, when do I know that LDN is doing something? 2 weeks.
2 weeks.
Yep.
Wow.
And here's what that something is. It's not that suddenly their condition is all better, their skin cleared up, or something really overt and obvious. What I hear within 2 weeks usually is, I just feel better. I just feel a little bit better. I can handle things a little bit better. It's that endorphin complex kicking in. It's that mental attitude of, oh, okay, I can do this. I've got this. I can feel better. And do you know, it's biochemical. It truly is. It's not just psychosomatic, because the way LDN works on our opioid receptors, it increases our pain tolerance. So even if pain and discomfort is still there, a person is better able to handle it. It improves mood. And we know that when we have a low mood or we're depressed, we have a lower pain tolerance. We have a lower tolerance to everything, right?
Mm.
So by improving mood, we can just handle things better. A person feels better. And that's when we know we're on track. And once we get to a dose where I start to hear that, I know we're on the right track. And it can take as little as 2 weeks.
Wow. It took me 3 weeks, and it was like
Yeah, there you go.
somebody had turned a switch or something. It was, one day I was feeling really bad, and then it was just like, whoa. It was so noticeable. Unbelievable.
Yeah. Oh, thank you for corroborating that. I feel like I'm out on a limb to say 2 weeks, because most of us say, oh, you got to stick with it for months, which you do. But that initial sign
Yes.
is right there in the first few weeks, isn't it?
Yep.
Cool.
Yep. 3 weeks. 3 weeks for me. And
Awesome.
I was really worried that it wasn't going to work. I wanted every side effect under the sun to know that it was doing something. And it had nothing, absolutely nothing. And there was nothing else I knew of that I could try. So it was just amazing, mind-blowing.
And did you have side effects?
No, didn't have
None.
anything. No. I could have been taking saccharin. It just didn't do anything, good, bad, or indifferent, until it kicked in, and then it was amazing. But in those days, it was totally different to what you're saying now. Everybody started on 3 milligrams and for a month, and then went up to 4.5 and stayed on 4.5. I was really lucky. I could tolerate 3, and I was fine on 4.5. But the dropout rate was high, as you can imagine. 3 milligrams was far too high for some people, and was always going to be too high. And what you were saying about finding your optimal dose, going back 17 and a half years when I started, the goal was always 4.5. But some people, their optimal dose is 2. And once they go over 2, it's not so good. But I have some people saying to me, I'm trying really hard to get to 4.5. I think I'm going to have to stop because it's making me feel so ill. But I did really well on 2, but it's a shame that I can't go to 4.5. So it's like, well, stay on 2. Yes, but I've got to get to 4.5. No, you haven't. If 2 works fine, stick with. But some people find over a period of time, and I haven't, I've stuck on the 4.5, is that they feel they need a higher dose. So let's say that somebody stays on 2 for 5 years or something, and then don't feel as good, and they could increase it to whatever, and then feel as though they've got the benefits again. So I don't know whether they tolerate it better or something. What do you think about that?
Well, as we age, or shall I say, as time goes by, our liver may not function as well. That's very common, right? So if they're not processing medicine out, what I would think is they may need to go down a little bit if it's accumulating in their system. That would be a liver issue. Homeopathically speaking, if the body sort of attenuates to a certain dose, that becomes their new baseline. And then in order to see a good effect, that's when you may need to go up a dose. And now it's like sending a new fresh signal to the body to go a little bit higher. So yeah, it's nice to have that wiggle room and be able to go up or down, which the truth is we always have that wiggle room. If you're at 4.5, you can go up to 5. There's not a rule against that. You can go back down to 4. That's the magic of custom compounding, is you can make it whatever dose you want. So that's great.
There were quite a few people on 6. That noise is back. 6 milligrams. I'll try and talk quietly. Do you have patients on higher doses?
I do not. I've never seen the need to go up that high. I would agree with one of our speakers from this conference that was saying if they're very, very overweight or they're trying to achieve weight loss, I do go up a little bit higher, because that's based on the research behind Contrave, where you combine it with Wellbutrin. And I have had good results with that. I don't work specifically a lot with weight loss, but a couple of patients I've done that with, and that works just fine.
That's interesting. So what else has happened in your practice over the time that you've been prescribing LDN?
Well, I guess with autoimmunity, that I've actually tried to narrow my practice a little bit. It's very hard to be jack of all trades, and even saying autoimmunity, it still means you got to know a lot about a lot of different things, but the approach can be a little bit more streamlined, and that creates expertise. So I hope I'm still on that path to continually learning and becoming a little more honed in on all the other factors that will help my patients. So LDN is not just a single silver bullet. It's part of a treatment plan. So I've always been a big fan of food sensitivity testing. There are a couple of different types of tests out there. One, of course, are the immunoglobulins. We've been using those for a long time, IgG and IgA. But there's also peptide testing, which I'm into now. This is a more recent food sensitivity test I've brought into my practice, and it's just a lot more specific. So I'll give you a quick example. A person may not be lactose intolerant, but there are many, many other peptides in dairy that can cause a reaction. So peptide testing will look at all of those different peptides, not just lactose. So a person might be dairy sensitive based on a different type of peptide. Same with gluten. So people say, oh, I'm not celiac, or oh, I don't have gluten sensitivity, but there's so many other protein complexes that can cause reactivity, and especially in autoimmunity. So I really appreciate that to test that new technology. This is the drumbeat right now of holistic health, which is fix the gut, which starts with food, your food sensitivities, and healing the gut. Cleaning up your environment. So I've added a little bit more education around that. People find this hard. It is hard. It's hard to change our patterns and habits, isn't it? Mm-hmm. But what are you cleaning with? What kind of toxic chemicals are in your environment? If you're a thyroid patient, what else is competing with that crucial element, iodine? So are you exposed to fluoride or chlorine? Getting those out of your environment. It might mean changing your household water, adding filters on all the faucets. So it's a work in progress, truly. And I often tell my patients, I don't want to overwhelm you, but there's always something you can work on. There's always a way to make things better. And if you're really committed to your health, then let's just start chipping away at this list and cleaning up your environment, both inside and outside your body. So I recently had my blood work done, my food sensitivities, all my annual blood work, and I was the patient, and it's so hard. It helped me empathize with how difficult it is to make these changes. And so one other thing I would tell patients is to be patient with yourself and not to feel like you have to do everything all at once. So with gluten, for example, I've started with, you take your normal foods and you try to find a gluten substitute. So I'm in the Southwest United States. We eat a lot of tortillas, right? Mexican food. And I'm telling you, the gluten-free tortillas just don't cut it. So, then we go to the next level of, all right, I guess I'm just going to finally cut the tortillas out or whatever. So now it's about finding whole new different ways of eating and bringing new foods in. And that's hard. Humans don't like change. So that's hard to do, but it's a step-by-step process. It's doable.
I have eliminated shampoo, conditioner, body wash. I make all my own natural, pure aromatherapy oils. Expensive to start with because you buy all these bottles. They last forever. And I have a body wash that I make with raw honey, and it makes, and vitamin E and oils and things, and your skin is so soft, and then you're showering and the water, it just goes in globules as it comes down because you're coated in this. I mean, you're not putting honey on you. It's only a fraction of honey, but it makes your skin really soft. Very nice.
I'm so proud of you. That's awesome. That's like the whole
Peppermint
next
cream.
step. Yeah.
Which is
Yes.
really nice. Yeah, and it doesn't take long. It doesn't take long at all. And my scalp used to be very dry. Made some shampoo and have tea tree oil in it. So you're massaging this tea tree oil in, and you leave it for 2 minutes and rinse it out. And my scalp is absolutely fine. It's not itchy. It's not flaky or anything. But I think getting rid of the chemicals that are in shampoos was a big thing. But as I say, they're very easy to make, and once you've spent the outlay, it must work out a lot cheaper.
I believe it does. I've done some cost comparisons with the things I make, and in the long run, it's usually less expensive. I think it's kind of fun mixing the little concoctions, and they smell so good. That's definitely next level, but it's so nice.
I tell you what else I made, which is amazing, is spray-on deodorant, and it's amazing, and it works really, really well.
Okay, you should start sharing your recipes.
Okay,
that would be great.
It does work really well. Yeah, so
that would be great.
Well, we've come to the end of our time with you right now, and it was amazing having you at the conference. Feedback has been second to none. Just one quick thing though, treating depression with LDN, there are some doctors that actually do double dosing for depression twice a day. Do you do that with your patients that you treat with depression, or do you stick to the 1 dose a day?
Almost always we're still at 1 dose per day. I might have one. I think I have one patient doing the 2 times a day. It's it usually, the reason I would do that is back to the sleep issue. If it's too high at night, then you want to move it to the morning, which is typically what I do, and that usually takes care of it. I don't often have to go to that twice a day dosing.
Okay. Well, we'll have to have you back another day and have another follow-on.
Thank you, Linda. So
okay. Bye now.
Thanks. Bye-bye.